You know, just because you feel good, you think you're healthy, there could be something deadly lurking in your body and you don't even know it. So how do you find that out? You have an eye exam. This is Dr. Joe Myers. He's an optometrist with Nationwide Vision Centers. And you know what, Dr. Joe, that sounds pretty simple to do. But I think we'd all be surprised at how many people don't actually come in for a yearly eye exam. How often should we do that, though?
Really, yearly exams are definitely going to be beneficial. There's a lot of different reasons why we would need to see patients sooner or later, but realistically, things can change in a year that should be checked.
Okay, all right. I bet if I asked anybody watching right now, when was the last time you had your eyes checked? Most people would be like, I don't really remember.
Yeah, it gets forgotten.
But you have had patients come in here and you have found some pretty amazing things. First of all, let's look at what a normal eye should look like. And this is a normal eyeball, right?
Normal eye. The
healthy.
White spot is the optic nerve. You see the blood vessels that are there, and a little darker spot off to the right is the macula. That's where we get all our vision from.
All right. So tell me about this patient.
This is an older patient who had been started on a medication primarily for arthritis, and what we're seeing here is a discoloration right in the area of the macula.
It's kind of fuzzy in the center there. Mm-hmm. And what is that telling you?
That's telling us the medication's causing a side effect.
And did she know that that was happening to her eye?
Not at all. Her vision was actually still very good. The doctors were confident in their treatment, but this is going on without her knowing.
Okay, which is a really good point to bring up here. Anybody who's on a certain type of medication especially should come in for an eye exam, maybe more often.
There's particular medications that hopefully the doctors will know, but yes, there's a lot of side effects that can occur in the eyes.
Okay. If she hadn't come in to see you, what could have happened?
Her vision probably would have just continued to decrease over time, and she would have been one of those people that comes in saying, my glasses aren't working, my glasses are the problem, and that's not always the case.
You know, people have come in too, and they've had headaches, and normally they go to their doctor for a headache, maybe in passing tell you they have a headache, and you've discovered issues.
Yeah, headaches are kind of just an interesting ball to unravel. It can be anything from dry eyes to God forbid, tumors, but MS patients, sometimes there can be some swelling around the nerve that the patient's completely unaware of. So those are a good idea to make sure you get the eyes checked. And as simple as a pair of glasses can help with those.
Oh, okay, all right. Well, that's an easy fix then, but sometimes it's not always so easy. Tell me about this patient.
This is an older gentleman who, again, is very normal, probably sitting on his couch at home, had no issues, family members brought him in, and he's got some changes to the nerve that is glaucoma.
Wow. And you can go blind with glaucoma.
You can go blind. So even though his vision was fine, he's now started the protocols and treatments for glaucoma, and hopefully in the long run he'll be able to save his vision.
And you've had so many other patients come in here who have had absolutely nothing going on, but maybe just not feeling well, and just through their eyes you can help them and propel them into some other diagnosis and treatment plans.
Yeah, and I think the diabetic population is the biggest known for that everything can feel fine. Maybe they're a little lethargic, maybe they have headaches, maybe their vision's just not as sharp as it should be, or maybe it's normal and they can have problems in the eyes.
How many times have you had somebody come in here, oh yeah, just getting my eyes tested, and bam, something
Probably
serious?
all of the pictures that we just went through were those cases.
Wow.
So just a more of a reason to get the eyes checked. There's so many things that can be going on.
Yeah, when we say they are a window to the soul, it's really so much more than that, isn't it?
It's very true.
Yeah.
It's very true.
All right, well, Dr. Joe, thank you so much, and yet so many more reasons why you need to get your eyes checked. Here's more information.
And if you would like to find a Nationwide Vision Center near you, call 1-800-EYE-CARE. You can also go online, nationwidevision.com.